Welcome to Constance YouTube. In my previous video, I discussed on the latest paper that reports that SARS-CoV-2, the COVID-19 virus, stay 5 times longer than the influenza A virus on a human skin model. So the COVID-19 virus may have a higher risk of contact transmission than influenza A virus. Thus, hand hygiene is critical in preventing the spread of the virus. In this video, I will be sharing with you on hand hygiene and the safe use of hand sanitizers for COVID-19. You will learn about the latest recommendations on the hand hygiene and the safe use of hand sanitizers. This is the current situation in terms of treatment and vaccine development for the COVID-19. The US FDA has just approved the first antivirus to treat COVID-19 on the 22nd October 2020, and the COVID-19 vaccine has its own concern as raised by experts. They have a concern that some vaccines may increase the HIV infection risk. Remdesivir is the first antivirus approved to treat COVID-19. It is not without any conflicting opinions. And the COVID-19 vaccine has its own concern as raised by experts. They have a concern that some vaccines may increase the HIV infection risk. These can be the topics for future videos. Since prevention is better than cure, it makes sense that virus containment and prevention of the infection is still the best way to control the pandemic. So, hand hygiene is critical to limit the spread of the virus. One way to prevent the virus spread is to prevent the contact transmission. You may refer to my previous post for the discussion on this paper and the importance of hand hygiene. Do you know that the best way to prevent the spread of infections and decrease the risk of getting sick is by washing your hands with plain soap and water? The US CDC recommends that washing hands often with soap and water for at least 20 seconds is essential, especially after going to the bathroom, before eating, and after coughing, sneezing, or blowing your nose. If soap and water are not available, it is recommended that consumers can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Is there any evidence for supporting the use of antibacterial soap? What kind of soap is better, a plain soap or antibacterial soap? Currently, there is no evidence that consumer antiseptic wash products, also known as antibacterial soaps, are any more effective at preventing illness than washing with plain soap and water. In fact, some data suggests that antibacterial ingredients could do more harm than good in the long term, and more research is needed. The WHO recommendation on obligatory hand hygiene to against the transmission of the COVID-19 virus says the same thing. Hand hygiene is the most effective single measure to reduce the spread of infections. Just now we mentioned when soap and water are not readily available for hand washing, an alcohol-based hand sanitizer can be used. But there are some safety concerns that we need to be aware of. In the next section, I am going to discuss some of the major points. Since alcohols are flammable, they must be stored in cool, well-ventilated areas. They must be used in well-ventilated areas as well. Alcohol may be damaging if applied directly to the eyes. Check your label. Make sure your alcohols are pure medical grade without being adulterated with methanol or 1-propanol. Methanol and 1-propanol are not acceptable ingredients in hand sanitizer and can be toxic to humans. I will provide you the link to do this checking. If you are not based in the US, you may have to consult the local authorities, as each country may have different lists. Only use these acceptable alcohols. The first one is ethanol, commonly known as alcohol. The second one is 2-propanol, which is also called isopropyl alcohol or isopropanol. The CAS is very specific for each chemical. You can double check just to make sure you get them right. This is the list that is provided by the US FDA. You can get the link at the end of my presentation. Never use methanol or 1-propanol containing the so-called hand sanitizers, because both of them are very toxic to humans. In the case of methanol poisoning, visual disturbances ranging from blurred vision to blindness can happen. At high dose, it can cause permanent blindness and death. For 1-propanol, it can decrease the breathing and heart rate and can lead to death if serious. These are the references that I used for my presentation. I hope you find this video educational and helpful. Please share with your family and friends for the benefits and safety. My next video will be on how effective is the alcohol-based hand rub solution for hand disinfection recommended by the WHO. Is there any evidence for that recommendation? Please subscribe to find out more. Please take care and stay safe. Thanks for watching and bye.